Hello again, welcome to the Azalea Health at Lunch webinar for July. We're getting ready to start. Thank you for joining us today. This is going to be a webinar. Our focus today is on surgery practices, using EHR to improve workflow and revenue flow. Featured today we have Dr. Eric M. Ward with the Valdosta Gastro and Endoscopy Center joining us. Kind of excited. All right, we've got Dr. Ward. Hello, Dr. Ward. How are you doing today?
I'm great. How are you?
Good. Briefly, Dr. Ward, I'm trying to get so I can read this, is certified by the American Board of Internal Medicine and Gastroenterology, which I have trouble saying. He completed his residency and fellowship at the Mayo Clinic in Jacksonville, and while there, he received the Resident Research Award and the Mayo Brothers Distinguished Fellowship Award. He's presented research studies at both regional and national scientific meetings, and has co-authored multiple articles in the field. Dr. Ward has been in the Valdosta area for about 10 years, and we're happy to have him join us today. We also have Baha Zaidan, CEO of Azalea Health. Zaidan has over 10 years in healthcare technology. He's been a key driver for the vision of building Azalea Health, and he's a strong proponent of health IT, cloud computing, mobile development, device computing, and big data analytics. We also have joining us Doug Swords, CFO of Azalea Health. He helped to establish Azalea Health's back office revenue cycle management service division, while also providing the financial planning and leadership for Azalea Health. And he also brings over 10 years of experience in the healthcare industry. Welcome to everybody. Thank you for joining us today.
Thanks for having us.
Let's go to our agenda today very quickly is focusing on how Dr. Ward surgery practices are using the EHR system to improve workflow and revenue flow, implementing best practices using EHR for your practice, steps that surgery practices should be taking now to meet meaningful use and ICD-10 requirements, and then sort of what do you see as the future of technology in surgery practice? So let's move along to the first question. First of all, Dr. Ward, again, thank you for joining us. And I know you've been using the Azalea Health EHR system for a couple of years now and are pretty familiar with it and how to use it. But in your perspective, how are you using the EHR system to improve your workflow and the revenue flow in your office?
Well, about 2 years ago, in April 2012, we went from the traditional paper charting system in our practice and converted to the all-electronic system using Azalea. And so we've really based our entire patient flow model around the advantages of using the EHR. We don't have anything on paper anymore. Patients check in at the front desk. It's all electronic. If I'm in my office, ready to see patients, I can see who's in our waiting room, see where the patients are along the way, which room they're in, who's next, all things like that. And at the same time, I can access all the previous office notes, get the test results, get everything I need to go in and see the patient and complete the encounter. Billing is a big advantage. The Azalea system, what they let you do with billing is a big advantage. With our old practice management software, I was always having to ask someone in our office to get stuff for me. If I wanted to check on something, always having to have people look things up for me. But with Azalea, it's all at your fingertips. I can have a question about an account or a bill or a charge. It's right there for me, easy to retrieve. Even somebody like me who is by no means an IT expert, by no means a billing expert, it lets me go through and very easily and quickly look at the information I need to know, and just really makes everything more efficient and much less time needed to complete the things we have to do.
And some of the workflows sometimes in surgery center, I noticed, Dr. Ward, that because of most surgery centers, and this is Baha, the CEO, by the way, most surgery centers, they typically have an office setting and also a surgery setting. And in both settings, they got different tax IDs, different, per se, different entities. And a lot of EMRs that we see and a lot of workflow sometimes within the same office, they'll see duplicates. That they have to add the patient in system A and the same patient in system B, because a lot of times, or sometimes 80% of the time, or 50%, depending on the practice, they will see the patients in the physician, on the outpatient, in the office visit, and then they refer them to the surgery center. Is that helping? Is the Azalea system helping you any in that process?
Oh, definitely. And we still have the same situation. We have our office practice, and we're a two-man gastroenterology group here in Valdosta, and we also have an ambulatory surgery center, or ASC, and so they are separate entities. And there's a separate section on Azalea, one for the practice side, one for the ASC side. But it's been about as seamless as I could imagine. It cuts down a lot of work. We're able to access the records when we need them from whatever location I'm at. And when we do the paperwork, not really paperwork anymore, but when you're doing all the things you need to document, getting ready for the procedure, having the way it's set up and communicating with the practice side makes it really easy.
And to get a little bit of technical, we actually, in our system, we have a way to allow physicians to be able to interface the patient. So as they add the patients in the physician, in the ambulatory surgery center, it would show up in the office practice and vice versa. And same thing with appointments. And we allow them to also open charts from either sandbox, per se, with no problem. And this is one of the advantages that we see for workflow.
Definitely.
Yeah, if I could add from a back office billing perspective, Baha made a good point. You want to ensure, especially if you're a surgeon who has your own surgery center, that your software can accommodate UB04 and 1500 billing. And that the demographics can be interfaced, like Baha said, so you're not having to key in the same set of data into two different systems. A couple other obvious or not so obvious reasons that the EHR can help your revenue flow is with surgeries, there's often, and especially this year and going forward, appeals that have to be filed, pre-certifications that have to be obtained, and a lot of follow-up work to get a claim paid. Well, with the EHR, you have all the records. You've got your labs, you've got your op reports, the initial H&P, all in one place. It makes it very easy to get a pre-certification and to follow up on denials and appeals. Another advantage is global periods. When you're using an electronic health record system like Azalea or like a lot of other systems, you can have access in one place to all the patient's previous visits prior to the surgery and post-surgery. So if you're trying to figure out if you've got a post-op visit and you need to use a particular post-op modifier, being able to use the EHR to track that information, it makes it much easier so that way you're not missing out on reimbursements from any visits that happen to occur at a post-op period. Another thing I want to point out is the code scrubbing capabilities of the software that allow you to, A, make sure that when you're at the point of data entry that you're using the right modifiers, especially if you have multiple surgeries occurring on one day, and then also being notified about CCI edits and bundling issues, so that way if you need to use an appropriate unbundling modifier, you can. The last thing that is very helpful is being able to see RVU data, and again, this goes to multiple surgeries that occur in one day. If you can see the RVU data in the EHR system, you could properly rank the CPT codes for your surgeries in the right order to make sure you get maximum reimbursement.
Thank you, Doug. Let's move on to the next question, which is also closely aligned to this, but sort of in your practice, Dr. Ward, what do you consider, how has EHR helped you to implement some best practices in your center? And I know you mentioned specific to GI how the EMR helps you. Could you tell us a little bit more about that, please?
Sure. Well, like the first bullet point says, a big part of it is patient recalls, patients coming in for their surveillance colonoscopies, or that they have Barrett's esophagus coming in for their follow-up or endoscopies. It makes it really easy to keep track of that, make sure we're contacting those patients. We've also subscribed to the service that Azalea offers with contacting patients and reminding patients about their appointments and their procedures to cut down on patients kind of falling through the cracks or missing their procedures. And it just makes it really organized, really easy, very intuitive system, and it helps us just keep track of what's going on, making sure we're not losing anybody along the way.
One of the things I'm intimately, initially when Azalea Health started implementing our EHR at Dr. Ward's office, we were it was at a very early stage, and he was one of our first early adopters of our software. So I've been intimately involved in their office, and I wanted to mention their office managers very, very involved in meaningful use and ensuring that they meet standards. PQRS is a big issue. How helpful is that to have somebody in the office is knowledgeable about that?
Oh, it's a big help, because I'm probably not as knowledgeable as I should be on some of these areas. But it's nice having someone in the office who knows what the requirements are, knows the time frame, to kind of help things along. And the staff at Azalea has been great with helping us meet the meaningful use requirements and those kind of things. My partner and I both just did our PQRS reporting earlier this year, and having the system with all the records and all the data available, so we could complete our PQRS data reporting. It made it a lot easier than it could have been with our old system, for sure.
Great, thank you. Let's move on to the next question. Great, thank you. Again, I know we were talking a little earlier about ICD-10, and everybody kind of cringes, and they all are into delay mode because it's not immediate anymore. But it still is important to know that there are certain things you should probably be doing now rather than waiting. I know, Dr. Ward, you have some suggestions to other surgery practices on what they should be doing now.
There's a couple things. We talk about meaningful use, and you're trying to make sure you qualify for that, and the PQRS reporting requirements, which can be very complicated and very hard to keep track of, and that kind of thing. ICD-10, we're in a bit of a wait-and-see approach. We've been talking with the Azalea staff about when we haven't started using the ICD-10 codes yet, but obviously we plan on doing that in the near future as the newest deadline gets closer. So that's on the horizon, and we've been talking, and Doug can probably tell you a lot about that, but that's certainly on the horizon, something we anticipate getting involved with and diving into that in the near future.
Yeah, a couple of things that we like to suggest, and that we're actually working on now, is building your crosswalk internally. So the first thing we usually recommend is to take your super bill, your routing slip, or take your list of most commonly used diagnosis codes, your ICD-9 codes, and look up the corresponding ICD-10 codes and build your own crosswalk. There's several online resources that are free where you can, really all you need to do is just Google ICD-9 to 10 crosswalk, and there's several of them out there. But what's going to happen is there's not a one-to-one. There's a lot more ICD-10s than there are 9. So what you have to do is when you're building your crosswalk, you have to sit down and say, okay, well, this is the ICD-9 code, and there's 5 to 10 alternative ICD-10s, and we need to decide which one or two of these we're going to use internally. And not only do you need to decide that, because unspecified codes are going to be frowned upon big time under ICD-10, but your documentation is going to be affected as well. So while you're building your crosswalk, it's going to allow you to think further into the EHR system about templates and charting, and saying, okay, now that I'm having to be more specific with my coding, how do I need to also update my templates? So maybe some templates have some diagnosis information embedded in them that you have to update. So making sure that not only do you have your billing, super bill, and most commonly used codes crosswalked and figured out, but make sure that that is also being reflected in your charts and your templates. I do like to point out that Azalea does offer we will put together specialty-specific crosswalks. So sometime after the webinar is over, you should be able to go to our website and find a general surgery-specific ICD-9 to ICD-10 crosswalk.
Or a cheat sheet.
A cheat sheet.
And another thing I want to add to ICD-9 and ICD-10, you know, ICD-9, we're moving from 14,000 codes to ICD-10 of over 130,000 codes. And what computers do best in computing is designed for data processing. And being able to have within your system the ability to cross-reference, do look up and search by different keywords is what your vendor should be able to provide you within their software. And that's something at Azalea that we're taking very serious, and we're going to be able to make the physicians' lives much simpler, much easier, because it's going to be just like Google. Basically, search for the code, and you're going to be able to crosswalk ICD-9, one code to many to ICD-10, but you can look and narrow it down yourself, and over time memorize what you have selected and be able to, you know, make the computer basically do the load, and you just be able to just use it in a search and select mechanism rather than memorization of those codes.
Great, thank you, Baha. Let's move on to the next question. All right, Dr. Ward, this is just sort of a wide open. What do you, now that you've been using EHR for a while and you're aware of all the technology out there, in your practice, sort of what do you see as the future? What would you like to see in the future for technology in your practice?
I like to see continuation of integration mechanisms with better communication between different systems that aren't necessarily from one vendor or one institution. It'd be, for example, in our ambulatory surgery center, we do lots of colonoscopies and lots of upper endoscopies, and we have our computers that we use to do those procedures and the documentation and everything. And I think the situation we have with Azalea works quite well. I'd like to see that get even better with even more seamless communication between the software that we use for our procedure documentation and our billing and EHR systems, and just further along those lines.
And I may add, as we look at what the results of meaningful use stage 1, stage 2, and future results of stage 3, which is going to be coming soon, is interoperability. Interoperability has been a huge impact on a lot of the vendors. One, it's simplifying things. Much is what's happening in the healthcare has been so information on paper, on charts, on some shelf somewhere. And as we adopting electronic health records and as we meet meaningful use measures, we're noticing that that data is going to be interoperable, more interoperable. But that interoperability is going to go to another level. One of those levels is going to be able to engage patients more. We're going to be able to see a lot of those social life applications, like the walking applications, the jogging applications, be able to connect and send that data directly to the EMR so the physician can see the social behavior of their patients. That's one thing. The other thing is wearables. I'm sure, Doug, you're probably wearing your Fitbit right now, but it would be nice in the future to be able to stream that data directly to the physician. And our future physicians are going to be able to see that information directly, not only your vital signs at that moment at the point of care, but rather more of your progress throughout your daily behavior, and seeing that and streaming that to the electronic health record. Also, another aspect that we see as in the future that's going to help physicians and patients, meaningful use is allowing patients to get more engaged with their electronic health record and more engaged with their care by allowing them to go online and be able to see their lab results, be able to see their clinical summary, be able to see their medication list, and so forth. But as a matter of fact, only a few percentage of the U.S. population who's utilizing that. We have to make that in the mainstream and to mainstream population. And to do that, we have to, as vendors, we have to develop software that constantly be simple for average consumer to use, provide tools to educate them on that. And I think you'll see a lot of physicians now be able to print not only just the clinical summary, but be able to download information about specific conditions and print them and give them to the patient. But that's going to be also streamed to the patient's smartphone, streamed to the patient's secure email, and so forth. And that engagement piece is going to constantly grow. But I want to add a couple more things there, and we'll open it up. Predictive medicine, with all of this clinical data, as software vendors, what we're good at is processing data and making that data helpful information. And we're going to be able in the future to kind of be in the predictive side, not the reactive side. So be able to predict from the data that we gather and at what point the physician should contact the patients and so forth. Nowadays, the physicians actually build those rules themselves, but as the software gets smarter and smarter, and as regulations get even more involved in the predictive medicine, it's going to help remind the physician and the patient in engaging with their own health care and their caregiver. And also the payment methods. In the future, our payment methods are changing to a lot more reporting and less just an episode of care. Is more of an outcome driven, and billing companies and companies with software companies are going to be able to help those physicians, guide them through that transition from a transactional medicine to a report or outcome driven and data driven payment methods. And I think that's going to be it's happening now, but we want to see that to be mainstream.
What I would like to see, and Baha touched on it, we're talking about mobility and mobile apps. And we already have this now with Azalea as mobile charge capture, from a medical billing perspective, especially when you're talking about surgeries. It may be in a surgery center attached to the office, or maybe you're in the operating room at the hospital, making sure that that billing information gets back to the billing office so that you can get paid. And having a mobile charge capture app is one way to do that. We really enjoy it here, and I see that being the future as well, making sure at the point of service that these codes and this information is being captured, so that way nothing gets lost in between.
Thank you,
everybody had some good ideas.
Yeah, that's right. The future looks bright for healthcare technology, and we are right there with point of service and getting it done. Now, right now, I want to open it up to the audience and see if we have any questions out there. If you do, please go ahead and type them in, and we can answer your questions. All right. We've got couple of questions coming in. Okay, Dr. Ward?
Yes.
Do you find that your EHR assists in documentation with requests from payers? And can you kind of describe that process a little bit?
Yeah, it certainly makes the person in our office whose job it is to get that information back and make sure we're fulfilling all of the requests that we get. It's just all the information they use at their fingertips, whether it's the clinical notes where we've documented the patient's complaints and our physical exam findings, or the results of other tests that we've done, such as radiographic tests or endoscopic tests. It just makes it very easy to access it, and using the functions in the system to fax it on to whoever's requesting it. It just makes it a lot easier, more accessible, and streamlines the whole process.
Oh, great. Okay, I think I've got another question coming in. Hold on a second. All right. I think this is sort of in line with your practice is in a small town. Has it been a challenge for you to recruit and find trained people for your surgery practice? And when I hear that, I also wonder, has it been difficult or a challenge at all to train new people in the EHR system?
A little bit on both accounts. You know, we are in a smaller demographic, and we do a very specialized business with what we do. So, you know, we found good people, and we've gotten them trained, and we've been able to retain some long-term employees who have been huge assets to the practice and to the surgery center. So, you know, it's like any business or any practice. You find the right people and get them trained, and you know, let them do their thing. And then the other part, I'm sorry, the second part was about people.
Yeah, I guess when you do bring, this is from me actually, when you do bring new people in, is it very challenging to get trained in the EHR system?
Sure. There's a learning curve for anybody. I think our staff picked up on it fairly quickly. This is the first EHR that we've had in the practice. We did have, you know, our practice management software, and we went to Azalea. We replaced that with the Azalea system as well. And having the EHR as well as the practice manager system both under the Azalea umbrella really made it a lot easier. I think it would have been a lot more difficult if we continue to try to use our old practice management software. So I think there was a little bit of a learning curve for all the employees, like you would expect with any new system, but they all picked up with it fairly quickly. I picked it up a lot quicker than I thought I would, and I think it's just a system that's easy to use and more intuitive than some of the other systems that we had looked at. So it takes a little bit of time for any new kind of operating system, but I think it went pretty quickly, and actually, quite honestly, a lot smoother than I was anticipating.
Great, thanks. We have one more question, and I know we get so involved in day-to-day, and we know it's big in the news, but how do you feel the Affordable Care Act? Is it having a positive or negative impact on your practice? Are you noticing anything from that right now?
I don't think we've noticed a great impact. Some of the measures that are probably going to affect it haven't entirely kicked in yet. We're monitoring the situation with the ACOs, for example, and there are a couple of ACOs in this area, in this region, that are getting off the ground. And to my knowledge, we really haven't had any ACOs come in our area yet that are up and running, but we're kind of keeping an eye on the situation, and I anticipate we will be involved with one or more ACOs in the near future, but at this point in time, that hasn't quite come around yet. We haven't really been affected by the insurance exchanges yet. There's, to my knowledge, there's only a limited number of exchange plans in this area. We are not on network with them, so we've had very, very few patients contacting us or refer to us that have one of the exchange plans. So, you know, it really hasn't been as much of an impact as I thought it was going to have. That might change in the future as more people get enrolled and things like that. So I don't think it's had a real big impact so far. We're kind of waiting and waiting for all these changes to hit, and we'll see how it goes. But so far, I don't think we haven't noticed much of an impact.
And our next webinar, I believe, Tamara, if you want to, it is about the Affordable Care Act. So, you know, we're excited to have that. And one of the country's leading people who know the most about it, Mr. Jimmy Lewis from the Hometown Health. He's the CEO of Hometown Health. He will be a panelist with me on that discussion, and I look forward to dive in and for, you know, to discuss the Affordable Care Act and the changes in the healthcare that's coming up.
Yeah, I'll talk to that one. I've got one more question, and this is from an internal audience, actually. Dr. Ward, and in your experience in dealing with your peers, what do you think is holding other practices back? They kind of fall back on the old systems using paper. What would you suggest to them, and what's holding them back to sort of prompt them to start using an EHR system?
Well, I think it's different for every practice. With us, quite honestly, I tried to drag my feet as long as I thought we could, except I really was not, I'm probably in the boat you just described. I really was not looking forward to abandoning our comfort zone and going into the electronic realm. And we knew that there would be different vendors that would come and go, and we wanted to make sure we made a good choice. Didn't want to have to start out with one vendor and then, if that didn't take off, have to start all over somebody new, 6 months later. So we were very careful. We looked at some systems. We decided the time was right, that we need to go ahead and get on board for the meaningful use requirements and some of the other advantages you can have of an electronic health record. But my advice would be, once you decide that it's the time for you have to go all in. You can't, there is some temptation to keep the charts around and maybe just do the new patients on the electronic system, keep all your old charts. And I think that's just going to make it more, just compound the misery. I think you just have to go all in, abandon your comfort zone, and once you find the system that seems right for you, just fully commit. And it's a little scary at first. It's a little challenging, frustrating at times while you're learning the system and while your staff is getting all the fine details worked out. But the staff at Azalea were great with help. They totally tailored and personalized the system to our specific needs. They helped us create templates. On the surgery side, they really designed the system from the ground up to so it would most help us and be most efficient for us. But biggest advice, you just have to go in feet first. Don't look back. Whatever other cliche you want to use, but you have to embrace it and go all out. But you just have to be careful and choose the one that's right for you. But once you make that choice, you can't look back.
Good point. It's always hard to take a step.
Just a last-minute note, Dr. Ward has really contributed a good amount of knowledge and tips on how to make our system better, more efficient, simpler, especially in a setting where they have an office and an ambulatory surgical center. And we can't thank you enough for all the feedback that you've given us throughout the process of implementing the EHR and actually using it and becoming as an advanced user. You've also helped us throughout the whole process. So we appreciate you very much.
It was my pleasure.
Thank you, Dr. Ward. And this is Tamara Hyatt with Azalea Health. That concludes our today's webinar. Just wanted to let you know we have recorded this, and that will be available on our website at azaleahealth.com. We'll also be offering a cheat sheet of ICD-10 codes, and we will also have that available on our website as well, probably within a week or two. I'll be sending out an email follow-up to everybody who's attended to let them know when that's available. And please, meanwhile, contact us if you have any questions or if you'd like to see a demo of Azalea Health Solution. Thank you and have a good day. Bye.